guys, and welcome back to the Cold Hard Truth with me, your host, Vilmy Steyn. On this week's episode, we are going to be discussing ECGs and some common abnormalities that are increasingly prevalent in our societies. With me in the studio today are three experts on the field of the heart, each going to be discussing a different abnormality. So, sit back, relax, and prepare to be entertained.
Hello, today we'll be talking to you about your ST segment abnormalities. An ECG can pick up two cardiac injuries, either by having an elevation or a depression of the ST segment. Now, the normal position of the ST segment is on your isoelectrical line, and any deviation from this line can mean a cardiac injury. Now, the two cardiac injuries are, first, your ST segment elevation myocardial infarction, and second, your non-ST segment elevation myocardial infarction. Now the first one, your ST segment elevation myocardial infarction, which we use the acronym for STEMI, is a full thickness myocardial injury. In other words, the myocardium of the ventricles is infarcted or damaged due to a decrease or interruption in the blood supply, which we normally call ischemia. Now the second one, your non-ST segment elevation myocardial infarction, which we use the acronym for non-STEMI, is only a partial thickness myocardial injury. In other words, only a part of the myocardium of the ventricles are damaged or infarcted due to a decrease in the blood supply only.
Wow, Monique, who would have thought such a short name could carry such a load of information? Tell us something about the epidemiology.
It accounts for 7.4 million deaths worldwide and is responsible for a third of deaths in individuals 35 and older. An important thing about acute coronary syndrome is that its incidence increases with age, and since there is a significant increase in the elderly population around the world, it will be a major health problem in the future. The incidence is also more common in your low and middle income countries. Most of the people presenting with acute coronary syndrome are males, with a high percentage of 58.15%, especially your elderly males, with a concerning 69%. More than 80% of people presenting with acute coronary syndrome report at least one of the following major risk factors.
You spoke about major risk factors, Monique. What are these factors?
These major risk factors include cigarette smoking, hypertension, dyslipidemia, abdominal obesity, and diabetes.
Wow, Monique, that sounds absolutely deadly. Is there any way we can prevent this from occurring?
Stop smoking, live a healthy lifestyle by having a healthy diet and adequate exercise. Make sure you control blood pressure, diabetes and dyslipidemia. Be compliant with your medications, especially if you are using aspirin, and make sure you do comprehensive risk assessment every now and then.
Wow, Monique, that was so interesting. It almost felt like I was back in Dr. Kerr's class, having to take loads of notes. Our second guest for this evening is Dr. Rickert. He will be discussing bundle branch blockages with us.
So as the electrical impulse moves from the bundle of His to the left and right bundle branches, it causes the myocardium of the ventricles to contract simultaneously. So now, as the name suggests, a bundle branch block would be an occlusion or obstruction of either the left or right bundle branch, which means that the impulse can't move to the area it usually needs to supply for contraction, which means that the ventricle affected by this block will no longer contract, or will take longer to contract, which means that instead of contracting simultaneously, the ventricles contract in a dissynchronized fashion.
I really hope my heart bundles aren't blocked. Heinrich, tell me, how prevalent is this?
Well, that's a very difficult question to answer because different people have different risk profiles for having a bundle branch block. But the universal sort of prevalence for bundle branch blocks would be 0.1 to 0.8% of the general population. That would mean every 1 or 2.8 in 1,000 people.
You mentioned something about risk profiles. What is that?
Well, there are different risk factors that make a person more prone or likely to have a bundle branch block. For instance, you have fixed risk factors like gender, where studies have shown that men are more prone to have bundle branch blocks than females. Age is also a fixed risk factor, where dozens of studies have shown that the older you get, the more prone or more likely you are to have a bundle branch block. I read a study recently done in Korea which showed that men above 40 have a 1.5% chance of having a bundle branch block, whereas men over the age of 65 have a 2.9% chance. Then you have modifiable risk factors, such things that you can do something about, such as smoking, hypertension, diabetes, and obesity. So all of these risk factors contribute to a person's risk profile. So statistics vary depending on what group you look at.
So, if I'm not mistaken, a bundle branch block is something like a traffic jam. I really hope I don't get stuck in that when I leave here. We have to finish soon. Thank you, Heinrich. That was really insightful. Our last guest of this evening is Dr. van der Vyver. She is going to be discussing left ventricular hypertrophy.
Hypertrophy is defined as enlargement or thickening of the walls of an organ. In left ventricular hypertrophy, the left ventricle, which is the main compartment that pumps blood throughout the body, is affected. It is mainly the body's response to increased blood pressure or hypertension. As the blood pressure increases, the workload increases. As the workload increases, the thickness of the ventricle and often of the total heart increases. As the size of the heart increases, elasticity decreases, which may lead to total heart failure.
Now I know what happened. I didn't get fat over the holiday. My body merely underwent hypertrophy. Tell me, Jackie, what is the disease occurrence of left ventricular hypertrophy?
It is estimated that as many as 15 to 21% of the population have this condition. That would mean that 1 out of every 5 adults will have left ventricular hypertrophy.
Not to kill the mood or anything, but Jackie, tell me something about the morbidity and mortality.
Left ventricular hypertrophy is strongly correlated with the development of a great number of diseases. Comparing a group of patients with left ventricular hypertrophy to a group of patients that do not have this disease, the prevalence of myocardial infarction is 11% in left ventricular hypertrophy compared to 4% in the other group. Occurrence of stroke was 6.4% compared to 2% in the other group. The group with left ventricular hypertrophy showed an increased history of hypertension, 52% compared to 29% in the other group, and diabetes, 8% versus 4%. Left ventricular hypertrophy is associated with the doubling in mortality of all races.
What are the risk factors associated with LVH?
Well, the first risk factor is age. For both men and women, the prevalence increases with age. However, in the younger populations, left ventricular hypertrophy is twice as common in males. The second one is sex. Women generally have a 16% prevalence compared to men who have a 19% prevalence. The third thing is race. The average left ventricular mass index for both women and men shows to be greater in the black population. The fourth thing is obesity. For both males and females, the higher the body mass index, the greater the prevalence of left ventricular hypertrophy. The last risk factor to look at is hypertension. This is the most important risk factor. There seems to be a direct correlation between left ventricular hypertrophy and elevated systolic and diastolic blood pressures. This does not mean, however, that the presence of hypertension indicates the presence of left ventricular hypertrophy.
That's it for today, folks. Join us next week where we will delve deeper into the heart of the matter.